Welcome back. I'm Sherry Small in with tonight's 5 on 5, and joining us is Kelly Jo Hamman with OHSU Knight Cancer Institute, and you're here to tell us all about the Asante Rogue Regional Medical Center and their new genetic counseling and testing that they're going to be offering. Tell us, what is genetic testing and counseling?
Yeah, so basically what we do in a visit, and this is going to be done via telemedicine, so myself and the medical geneticist, Dr. Sampson, are going to be up in Portland and seeing the patient here in Medford via telemedicine.
Okay.
What we do is we ask questions about the patient's personal and family history of cancer, talk about what the recommendations would be for surveillance for them based on the family history, or if genetic testing is appropriate for that individual. Okay. If testing is appropriate, we help coordinate the testing and then help interpret the test results as well.
And what types of cancers can you test for?
There is genetic testing for different inherited cancer syndromes. The most common that we do send testing for and that people are usually most familiar with is for breast cancer. But there's also testing for inherited colon cancer syndromes. Some of the syndromes we offer testing for include renal cancer, thyroid cancer. Obviously ovarian cancer is also at an increased risk if a person has a BRCA gene mutation. And there are a few others as well that are more rare, pheochromocytomas, paragangliomas, medullary thyroid cancer. There's, a host of different testing that can be done for these individuals.
And this is just to find out if you have a genetic predisposition?
Correct. So most of the genes that we offer testing for, we all have 2 copies of both of those genes. If a person has a mutation, that's a change in the gene that we know predisposes them to certain types of cancer. It's in one of the 2 copies. But as long as that person has the other copy normal and working properly, cancer doesn't develop. However, if that second copy also becomes damaged, a tumor could develop. And so if a person is born with one of those 2 copies with a mutation, so that copy is not working, they're just more likely to develop cancer in their lifetime.
All right.
And because of that, we sometimes see younger ages at cancer diagnosis in the families. So one of the things we look for breast cancer, for instance, is premenopausal breast cancer or other breast cancers under age 50. A person or a family who has multiple people affected by the same type of cancer. So if there's a few generations of breast cancer or related cancers in the family, like breast and ovarian cancer for a BRCA gene mutation, maybe colon and uterine cancer for one of the inherited colon cancer syndromes. There's different things that we look for when we're getting that family history.
All right, and stay with us, and you stay with us as well. We'll be right back and continue this with more information. We'll be back right after the break. Stay with us. Welcome back. We are joined with Kelly Jo Hamman with the OHSU Knight Cancer Institute, and they're teaming up with Asante Rogue Regional Medical Center for genetic testing and counseling to see if you have a predisposition for certain types of cancers. So who is the appropriate candidate for this counseling?
Well, when we start testing in a family, we always like to start testing, if possible, with a person who has been affected by a certain cancer. So if there's 2 sisters in a family, the sister that's had breast cancer is a person we'd like to see first to begin testing. Some of the features in families, like I said, are young ages at diagnosis. So if a family has premenopausal breast cancer or ovarian cancer in a family at any age, individuals who are diagnosed with colon cancer under age 50, or who have some different screening tests that show that it is more likely that this is an inherited cancer syndrome.
And I can't imagine anybody who wouldn't want to know if they're predisposed to a certain type of cancer, but finances might come into play. How expensive is this, and how affordable is it?
Well, the genetic testing actually is usually covered by insurance companies as long as that patient meets certain criteria. And truthfully, if we're going to order testing for a patient, they usually do meet the criteria because we think it's medically necessary for them to have the testing. So it is usually covered by insurance companies, and we always work with patients before the test is started to determine if it's covered, how much is going to be covered. So they'll get that information ahead of time.
So it's not just for the rich and famous anymore?
No, we can afford the testing.
All right, and if someone would like to know more about how they can sign up?
Sure. We always recommend talking, with their primary care doctor and getting a referral to Rogue Regional Medical Center for genetic counseling. The number for them to call is 541-789-5006.
All right. And how long and when does this start?
We actually had our first telemedicine consults today, so it is underway, and we're going to be doing it twice a month. And results from testing usually take about 3 weeks for most testing. So once a patient is there and has their sample drawn, results usually about a month.
All right, Kelly Jo Hamman, thank you so much for joining us.
Thank you.
And stay with us. We'll be back with more news right after the break.